Hello, my name is Jessica Thomas, and I'm an obstetrician gynecologist at Legacy Community Care Center in The Colony, Texas. We strive to be a partner in patients' care throughout the various stages of a woman's life from puberty to menopause. Our services include OB and gynecological exams with health screenings. We now have available postpartum care, risk assessment, education, counseling, and breastfeeding support. Our certified midwives strive to be a partner in patient care, providing pregnancy and well woman care to women throughout their lifetime. Pelvic inflammatory disease is a frequent and important infection that occurs among women of reproductive ages. This clinical syndrome results from the ascension of microorganisms from the cervix and vagina to the upper genital tract. Prolonged exposure to STDs such as chlamydia cause PID. PID can lead to infertility and permanent damage of a woman's reproductive organs. Although cases are declining, there is an estimated 2.5 million women in the United States reporting they have had PID over a lifetime, which makes up 14% of the population. The ages in these women are between 18 to 44. Most common symptoms include adnexal tenderness, irregular menstrual bleeding, cervical motion tenderness, and pain for intercourse. PID has been linked to ectopic pregnancy, tubal factor infertility, and tubal ovarian abscesses. Endometrial biopsies and transvaginal sonography have become more popular in the diagnosis process. Several types of antibiotics, such as penicillin, that is prescribed but do not reverse any scarring related to the infection. That is why it is so critical to seek care if there are any symptoms of PID. The severity in most cases are mild, and subjects can resume normal healthy sexual activity after the treatment period of 7 to 10 days protected. Patients can resume unprotected sex after 60 days. In this case study, the patient's name is removed for confidentiality, date of birth being 9/6/1986, 30-year-old African-American female with her BSN college graduate. Risk factors and previous medical issues include the history of PID, infected with history of gonorrhea or chlamydia, multiple sex partner, insertion of the IUD, and bacterial vaginosis. Treatment for 14 days of doxycycline, 500 milligrams 2 times per day, and remember to take it until they are all consumed. Do not save any for future infections or share with a partner. I recommend that this issue be made more public and that we raise awareness. Preventatives and contraceptives need to be made available for those who cannot afford it. Follow-up testing is encouraged after 3 to 6 months to monitor reoccurrences. The sensitivity towards patients' needs are essential in making lifestyle changes. Other providers may want to use a personal approach to help educate adolescents. An issue that still needs improvement is patient compliance. Poor medical literacy and diagnosis leads to failure to notify partners as well as medication sharing. In conclusion, the improvement in the way we share knowledge may assist in decreasing pelvic inflammatory disease cases nationwide.